Hello humans, welcome back to Dr. Rose Helps You Hear. I'm Stephanie Rose and I'm an audiologist. October is Audiology Awareness Month, so today we're going to be talking about one hat that audiologists sometimes have to wear that we don't learn about in school books. In the news recently, I noticed that there was an article that was talking about how the auditory cortex is actually active until our last moment of life. So the question is, can we hear even if we're unresponsive and pretty much on our deathbeds? And the answer is, we don't know if we are registering what we're hearing, but we are certainly having our ears be active in our brain. Going back to what I was saying earlier about audiologists wearing this certain type of hat, that's basically what it is like to be a hospice audiologist. So what happens when you have a patient who has now been diagnosed with a terminal illness, is slowly on their way to their last day? How do we change our responsibilities? What do we need to do to assess that patient? A lot of times these patients are not able to leave their hospice house, so we have to kind of go on the fly with what we know about the brain, what we know about the ears, and just do everything that we can to help the family make sure that the patient can hear them until they're no longer here. Very often the cognitive status of the patient starts to slow down, and so a lot of times patients' families think that it's the hearing aids are at fault. And also during a pandemic, they haven't been able to get their ears cleaned, so we can run into some cerumen problems if the patient is not able to be visited by a traveling physician. As a hospice audiologist, I try to make myself as available as possible, working in devices for cleanings, replacements, repairs, anything that I can to help that patient continue to hear. It's very, very important that we don't lose sight that they have working auditory systems, and it is our responsibility to help them hear their best up until they are no longer here. So another thing that we want to make sure of is that we're orienting the family on how to clean the hearing aids because the patient's no longer able to do so. They don't teach these sort of things in books. I didn't learn about this in doctoral audiology school. I understand that this is kind of a depressing video, but we need to talk about it. We need to make sure that we are polished in all aspects of audiology. And since it's Audiology Awareness Month, this is just something that we need to be aware of that we might have to do from time to time. So that's my purpose of why I'm doing this video. If the family is not able to insert the hearing aids for the patient, or if the caregiving staff is not able to insert hearing aids for the patient, then I would recommend a pocket talker, a simple amplifier that has headphones that the patient can wear, and then they can just slowly turn up the volume until the patient is able to respond. If they're not able to respond, then I wouldn't recommend a pocket talker. I would recommend wearing their hearing aids and just putting on their hearing aids because that was at least the last known sound prescription for them. If the patient has been going through ototoxic treatments or treatments that can hurt the hearing, then, and it's past those ototoxic treatments. If they're in hospice, then we definitely shouldn't mind giving a little boost, maybe 3 to 6 dB across the board, just to give them a little more awareness and sound access. And then also to make things, as enjoyable as possible if they're having a hard time hearing the TV, or especially family members. And doctors are also important. So sometimes you have to bend your typical regimented textbook rules to follow to be able to assess the patient from afar, and also to be able to assess the patient for any changes that might have occurred that you're not able to test. So as a hospice audiologist, you have to make sure that you're communicating well with the family about what kind of changes you're making so that they can report back to you whether or not those changes helped in however they're assessing that patient or that family member. So, are they opening their eyes more? Are they nodding or responding to questions? So any kind of little response is always great. And if they're not able to get any kind of response, even just eye blinks are good to know if they're getting some kind of sound information. I will post the research paper that I read about the auditory cortex being active up until the last minute of life in the comments. So if you guys want to see that, go ahead and look in the description of the video. This is where I'm going to be filming from now on. This is my new YouTube studio. I hope you guys like it. I'm in between microphones right now, so I apologize if you can't hear the sound well, but that should get better with time. Anyway, thank you so much to my 400 subscribers. I can't believe that I have that many subscribers out there. It's such a pleasure to make videos for you guys. And if you have any ideas or if you have any questions, please post them down in the comments. Thank you so much. Have a great rest of your day and stay well out there. I hope to see you again next week for another video. Some people call me an audiologist. Others call me a hearing nerd. Being human with hearing loss is like my superpower. As a hearing doctor, I get to help people hear their best while learning about the mysteries of hearing.